Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we talk quality of healthcare and explore what that actually means. Let's dig into performance measurements via Quick Platform, pharmacy goals, and personal goals. We will also occasionally cover topical healthcare news and maybe throw into the conversation a few of our own nerdy passions and hobbies. So turn us up. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and welcome you to the next episode of the Quality Corner Show. April is Stress Awareness Month, and this is a time where stress levels could be at an all-time high due to the impact of COVID-19. Pharmacy may be a high-stress environment already. It's fast-paced, it's high stakes, and increasingly in recent years, we have seen more open conversations about the impact this may have on the mental well-being of pharmacists and pharmacy technicians. With the current COVID-19 pandemic, it has been increasingly recognized that our pharmacists are heroes on the front line of healthcare. Now, this topic can be very sensitive, and it was also determined that we really want to bring in some external experts to have this conversation about stress in healthcare, but specifically stress in pharmacy. Now, please allow me to introduce our guest, Dr. Jessica Louie. Jessica, welcome to the show.
Thank you for having me, Nick. I'm excited to be here.
Yeah, absolutely. As we get started and as we became connected, I stumbled upon your group, the Spark Joy in Healthcare, and also through your podcast. Before we get started and into our conversation, our questions for today, it would be great if you could share a little bit about your background as a pharmacist, and then about your organization, your podcast, how you got into some of these initiatives.
Yes, that's a great question. My passion is really about helping people find confidence, to live intentionally, bring meaning into the world in any way, their skill sets allow. And how I do this is through my work with the Spark Joy in Healthcare initiative. And by day, I am a pharmacist. I am a board-certified critical care pharmacist and an associate professor at West Coast University School of Pharmacy here in Los Angeles. So I've been, doing those things for the last 5 years. I am a 2013 graduate of University of Southern California School of Pharmacy and went on to my 2-year residency and joined academia and got into some businesses on the side as I experienced burnout in the pharmacy profession. So, fast forward from the last 5 years to 2020, I have started a new initiative to give back to the pharmacists on the front lines with our Spark Joy in Healthcare initiative and community to really, send these pharmacist care packages to them and really give back so that we can bring joy into every day.
Yeah, thanks, Jessica. I appreciate the background information that you've shared there. To me, it's important to note that when we do talk about stress or stress in healthcare, there's so many people in different roles with pharmacy, right? It's such a broad practice of healthcare to some degree, and you still are a practicing pharmacist, but at the same time, you've looked at how you can help promote talking about the topic and contributions to making pharmacists more comfortable and open with it. So this is something I'm really excited. I'm glad that we were able to connect. And, for me, it was something where I kind of just got lucky looking on LinkedIn and finding your organization. So I'm really excited. And we're going to, hopefully with this conversation, will help to spark more joy in healthcare. So we'll go ahead and get started for today's conversation and going through for the details. Now, for pharmacists, we've always had our share of stress to cope with, and this month in particular, probably dealing with lots of different forms of stress, whether it's in the pharmacy or in the hospital that we're working, or certainly as it relates to care at home, given the current situation. So as we're going through and talking about joy in healthcare and how we're able to manage these different parts, do you mind sharing a little bit about your group, Spark Joy in Healthcare, the particular approach, why it's important and what you're looking to achieve to help pharmacists?
Yes, that's a great question. So basically, the group is really geared towards putting this community of pharmacists together so that we have mentorship, we have coaching together, and we really come together as a group to inspire one another, uplift one another, and empower one another. So, it's different than some of the, professional organizations that are out there in pharmacy because it has a different mission and purpose. Because we were not going to necessarily talk about, what's going on in the pharmacy profession. We're going to come together to talk about, not necessarily to vent or anything like that, but we're going to come together as a community to share, what's going well, how we're bringing joy and well-being into every day, and, how our organizations and team members are supporting that. And also, if you don't have team members or an organization that does a lot of these things, because I know, I come from an organization that had a well-being and resiliency center for all their employees, not while I was going through burnout, but afterwards. And, a lot of organizations still don't have those. So this is an area where we can fill that gap where you don't feel like you're alone during all of this. Because I know I felt really alone when I was going through burnout 5 years ago. So that's kind of the premise behind it. And then it will link together with the podcast, which is, geared towards well-being, burnout, decluttering techniques, and then link towards some of our free resources about how to reset burnout.
And when you talk about that and you reference decluttering and somewhat with changing the mindset, I may be assuming here, but it sounds like that may be based on some other concepts. Would that be correct?
Yes, it is. So if you don't mind, I'll share a little bit about my burnout story so
Sure.
that it becomes a little bit more clear. So basically, my approach to burnout is about in the individual level. What can you personally do to help with it? So back in 2014, 2015, during my second year of residency and first year in academia, I definitely had burnout. I didn't know it was burnout at the time. And I was just accumulating things in my life because that's how I coped with the high stress levels that turned into burnout. And many of us will cope in different ways, either by shopping or eating foods or some other type of addictive behavior. And in order to break that, we, first have to realize that something is going on in our lives. And I had to realize that. And a life event happened to help me realize that. And basically, what I can attribute to a lot of my burnout being reset by is by decluttering my physical environment and then my mental, emotional environment. And I did that through reading Marie Kondo's books on the KonMari Method. Many of you might be familiar with her because of her books and or her Netflix show. And, it's just a way to really reset what brings you joy in life, both physically and then applying that same concept to your calendar and your schedule, to your finances and your community. So I went through that process back in 2015. And over the last 5 years, I've since become certified in the method and really use that as how we clear the clutter from our lives as a way to address all those stress levels. Because if we're not, happy and joyful at home, we're not necessarily going to be joyful at work. So that's a lot of what we talk about, focusing on the individual level versus focusing on like the organizational level for changes.
Yeah, Jessica, thanks for sharing that and your story as well. Appreciate the context and understanding. And it's really, I think for a lot of us, we all deal with stress in different ways. We all manage it. We perceive it in different ways. So maybe something we realize, and maybe something that it's the people that are closest to us that catch on to those. And but ultimately, it's up to each and every one of us to have a response and to reach for. There may be a lot of hands that are extended already for help and assistance. We got to reach for that, or sometimes it's having to go out and seek that. But these are personal choices, and it's up for us on controlling that. We'll go ahead into the next part, and with your organization, I know that you've been doing a lot in recent months in helping to support pharmacists, and I'd like to dig into that a little bit and see what kind of feedback. I know I've had different friends, colleagues, mentors on the front lines of pharmacy that I've heard different responses from as it relates to COVID-19 and how that has added to stress with pharmacy. But what have you been seeing and hearing from pharmacists? What kind of items are they sharing with you? And are there particular items that are more magnified now than what they previously would have been? Do you mind sharing a little bit just on the current response?
Yes, definitely. So basically, just so everyone knows, we're sending out these pharmacist care packages throughout the United States. And right now, we've sent out care packages to about 400 pharmacists and team members. And our next round going out this weekend is going to reach another 300 pharmacists and team members. And, a lot of pharmacists who reached out to me to nominate their own team or to nominate a colleague or a past student classmates team has really been about, there's a lot of fear around this, a lot of uncertainty and overwhelm because, especially back in March, there wasn't a lot of data around COVID-19. And, when we don't have a lot of data and we don't really know what the future holds, it can breed a lot of anxiety in people. So I heard that a lot. I also would say that a lot of our frontline workers, are in retail and community settings. And then there's also our hospital pharmacists that are there. Some of them are working on site, some of them are working virtually. But basically, some of the things that people didn't necessarily like about their job environments have become more magnified. And just being able to take a step back and, have that time at home with family, I think has shown that, what is really important in life, what is the legacy that you want to leave. And there's been a lot of discussions between, people in the community that have talked about reevaluating, what does their work-life harmony look like? What does their work-life alignment look like? I don't like to use the word work-life balance because in my opinion, nothing's ever balanced, but it really brings into those questions now that you've had some time to reflect over the last 6 weeks.
Yeah, thanks, Jessica. And to that topic, I think it's been very interesting to see how people respond. And as you said, evidence has been constantly changing around COVID-19. We've been covering that in some of our podcast or prior podcast episodes, and we had to give the disclaimer each time where this information is current at this time. We're all trying to get through it and trying to educate our patients, trying to educate those in the organizations that we're working with on appropriate responses, and really having to take each step along the way so that we can be focused and that we can be achieving positive results for those that we're working with. So I think, let's take it a step further now, and just whether it's COVID-19, whether it's pharmacy, kind of more generally, stress in any environment. And this part here, I think, is really key as well. We see a lot more now about stress in healthcare and stress in pharmacy. It's not as if there isn't stress in any other kind of job. It manifests in different ways, and everybody's kind of dealing with it in different ways or different approaches. But specifically, when we're talking about pharmacy, what can we as pharmacists do? Whether that's from our own standpoint in preparing ourselves and to mitigate that, or working with our organizations to improve workflow, operations, and other considerations there. Can you share anything that you've seen there, and maybe what are some best practices for yourself, but then also working with, say, your organization to help those?
Yes, I think that's a great question. I think that, as a pharmacist, you can start role modeling, how you want your environment to feel. No matter what job title you have, you are a leader within your organization, and you can demonstrate your work-life alignment. And this could look like, let's say, for example, in the terms of setting boundaries for work. And this is especially important, I think, all year round, but especially during the pandemic, in terms of one boundary could be that you're not checking emails outside of work hours or on holidays or on weekends. And this is something that you also remove from your phone so that you're not getting notifications for them. So if you are receiving emails right now with updates about what's going on in the world and different policy changes at work, you don't necessarily need to read them outside of that work time, because it can add more anxiety or stress to your day when you need to be, decompressing from work outside of work hours. It's also about setting up, your goals around areas outside of work. So when you're outside of work, having those goals around relationships, around your health, around your finances, so that you do have these goals that are not tied to work, and they're your individual goals. And then other boundaries would of course be using your vacation days or using your sick days when you need to make sure that you're taking care of yourself, because I hear this a lot, but people feel that if they take that time off, they're letting someone down. But if you're not taking care of yourself, you're not going to be able to take care of others. You're not going to be able to take care of your patients. So it's a win-win for everyone for you to take care of yourself and have those boundaries set up. In terms of, the organization as a whole, I think that it's really important organizations have these resources available for stress management and burnout. And that could include different things in terms of working with their own healthcare provider to provide some of these resources to their employees. It could mean that they're bringing experts for online workshops or webinars for their team members on different topics, either quarterly or monthly. I know that next week I'm coming in to a group of 250 pharmacists and, discussing 5 ways to bring joy into work. And, some of those are directly related to work initiatives, and some of those things are in your personal life, and they all intertwine together. So those are a few different ways.
Thanks, Jessica. And so when we look at some of those items, there's one part that I always think about when it does come to work, whether it's work or personal. And as I hear your comments, it rings true. So for me, it's if there's a problem that you recognize or acknowledge, it's always best to be the first one to present or provide a solution. It doesn't need to be perfect, and you may not have all the answers, right? But it can become very difficult, and it can create stress for others if you're just someone that's identifying problems without having ways that it can be fixed or addressed. People look for others and are driven to those that are helpers or that are looking to create change. So I think that's always a really key part of what your comments were there, and that can be items whether it's the personal or whether it's on the professional side. When it does come, and I've got another follow-up for you as it relates to your goal setting. You mentioned that from kind of a personal professional setting. What's the importance of that personal goal setting outside of work, and what are good ways to look at or track that? I think that may set some pharmacists off, because certainly there's different measures and metrics that may be used in the work. So setting kind of measures at home may not be an ideal part, but do you mind expanding upon why that's important and how that can help people, maintain their stress and keep a healthy balance?
Yes, I definitely was one of those pharmacists who didn't believe in it before. I never wrote down my goals. I was just trying to get to that finish line of, okay, you have to finish pharmacy school. You need to get board certified. You need to find this type of job. And I think that the first step is removing yourself from tying your job title to your self-worth. And I think that a lot of us do that, no matter if you're in pharmacy or somewhere else. So removing that, your self-worth is not based on your job title or your career. It's, you as a human being. And then, goal setting, if we don't say something out loud and if we don't write it down, I think it's very unlikely we're going to follow through on it. And for me, that took a little bit of practice over a couple of years to start doing that, because I never would do that outside of work. And I think that it's one of the first steps of, clarifying what you really want in life. And that's technically how I teach the clarify, simplify, align method I've come up with, where you clarify, what is your goals within 10 different areas in your life. So I call it the weekly joy check, where we check into 10 different domains. And these include your health, your mental, emotional health, finances, community, experiences, learning, etc., family. And when you write those things down and you come up with 10 different categories, those categories could be what I suggested or, something else on your list. Then when we check in with them each week and rate them of how we're feeling in each area from, let's say, 1 to 5, we can see, what areas we need to focus on for the upcoming week. And this means that you don't pick all 10 to focus on if they're all rating kind of low this week. We pick 1 or 2 to set a goal in for this upcoming week. And that could be very simple. It could be as simple as you received a text message from a friend last week and you never replied back, or you never set a date in your calendar to have a virtual call or a coffee date when we can have those in person again. So you make that a goal for this week to make sure it gets into your calendar, because if things don't get into your calendar, they usually don't happen. So that's, one way that we go through that process. The other way is I call it curating your goals. So basically we use this curate method, and we're going to reverse engineer your goals back. So you think really broadly, big picture, and think about what are your life goals? Like, what do you want to achieve in your life? You don't need to put a time frame on it. It can be really big things that could happen in 5 years, could happen in 20 years. And we reverse engineer some of those back into our daily goals. So you take those, you reverse engineer them into, okay, what am I going to need to do this year in 2020 to get one step closer? What do I need to get done in this quarter? And then the quarter is what we really focus on for 90 days, because that's a little bit less overwhelming. And then we'll break that down into monthly, weekly, and then daily. And, being able to put those baby steps together is really important, because the biggest barrier to any goal or anything in life is just starting, right? And breaking it down into a very small starting step is really important. So I think that the first step is to just give it a try and brainstorm, how you feel in other areas of your life outside of work right now.
Yeah, a couple things I noted there that are really important: setting important time frames, breaking down your goals, having different points there, and adjusting, being flexible with some of those items. I know for myself, and when we started to really have I know for myself, when the stay-at-home orders were really starting to get to me, I put together a checklist of items. I had about 10 items that I wanted to see how many I could do in a day that would help me keep my mental space clear. It turns out after day 6 or 7, I was spending a lot of time going for a run, just in my backyard or in the woods behind the house, or taking the dog for a walk, but I wasn't spending enough time communicating with other people. So that was something where it really pointed out to me that deficiency. So having that kind of tracking can become very helpful for your assessment of oneself. So Jessica, I really appreciate you joining for our discussion today. I really love seeing a pharmacist that is stepping outside what is just the practice of managing patient medication. There's a lot more that a pharmacist can and does do for helping patients manage their health effectively, and you're a great example of that. We firmly believe in our pharmacists and their capabilities as a member of the healthcare team, and to that end, pharmacists that are healthy and empowered are better able to use their talents to improve the lives of patients. So I don't think anybody's going to find that to be a controversial statement. Pretty straightforward, and I think we're all gung-ho about that. When we do get to this final part of the podcast, that we like to give our guests an opportunity to share a little bit about themselves, or perhaps some of their own message, something they're really passionate about that we didn't cover in the specifics of our topic. So with that in mind, Jessica, are there any final words or message you'd like to share for our pharmacist and pharmacy technicians?
Yes, so I have just one piece of advice: to bring joy into each day. And, if you're not used to that concept or don't know how to start, my suggestion is to ask yourself 3 questions each morning to prime yourself for that joy. And those questions are: 1, what can I get excited about today? It can be anything. I would definitely make it something that you can control. So don't necessarily say that you want it to be sunny out today. Get excited about something that is on your calendar that you're looking forward to. What is a situation that might stress me out today, and how will my best self handle it? So that, we experience those challenges every day, but if we prime ourselves to bring our best self to that situation, we definitely can view it in a positive perspective. And finally, the third question is, who can I surprise with a note, gift, or thank you today? And this can be as simple as a hug, if it's someone in your home right now, or it could be as simple as writing a note, a card, and sending it via mail to them. That's always great to see. And you can write these down or say them aloud in the morning. I think that if we all bring a little more joy into our days, we can bring more joy into the pharmacy profession as well.
Thanks, Jessica. And before we close out, do you mind sharing again where people can find you or contact you, and then your Spark Joy and Healthcare organization? Do you mind sharing where they can look into that for more?
Yes. The best place to get in touch with me is on my website. So that's my name, drjessicalouie.com. And the sparkjoyandhealthcare.com website is where you can get involved in our pharmacist care packages, nominate your team, or give back by sharing the initiative on social media. And on social media, I'm most active on LinkedIn and Instagram, so please connect over there.
Thanks, Jessica. On behalf of the PQS team, we greatly appreciate your participation for today's show and your message of positivity and change to support pharmacists. It's a very noble calling for a great profession. We appreciate that you're coming on the show today to share that message. There's a lot more that we can talk about with this topic, but keeping with the theme of stress management and decluttering, we're going to try to keep it simple and try to keep it free of some additional time. So we're going to close out our podcast today with one final message like we always do for our listeners. Our team here at PQS has a couple of favors to ask of you, our podcast listener. First, we encourage you to share this podcast with 2 friends. Because if you share this with 2 friends and each of them shares it with 2 friends, it really helps us hit a larger listening audience. Second, we also want to take a moment to remind you to subscribe to the podcast wherever you may find it. And then, if you have any questions or topics you would like us to address, please contact us. The best way to do so is to email info@pharmacyquality.com. Let us know what is on your mind and what we can address so that you are fully informed. Our goal is to continuously improve our podcast content and to provide meaningful information to our listeners based on current topics in healthcare, technology, and quality measurement. We want to help you become as effective as possible in how you care for patients and improve public health outcomes. So until next time, we wish you well.